Osteokinematic motions are generally what we think of when we refer to motion that occurs in our extremities and in the spine. Movement occurs when our bony segments rotate around a particular axis. Now, motion occurs around an axis, but it occurs within a plane. When we talk about motion in the human body, it's helpful to break things down by cardinal planes and cardinal axes. Our cardinal planes include the sagittal plane shown in green, the frontal plane in blue, and the transverse plane in yellow. Our axes are our anterior-posterior, shown in blue, medial lateral in green, and our superior-inferior axis in yellow. Okay, first up, let's talk about flexion and extension. Flexion and extension occur in the sagittal plane, which again divides the body into left and right halves around a medial lateral axis. So flexion is defined as when the joint angle between two bony segments decreases. Paired with flexion, then, is extension. It's defined as movement where the joint angle between the two bony segments is increasing. Here's an example of a couple of flexion and extension movements. So we can see in blue we have our sagittal plane and our yellow represents our medial lateral axis. Here we're demonstrating elbow flexion and extension. Here's another example showing hip flexion and extension. Again, motion occurring in the sagittal plane around a medial lateral axis. Next up we have abduction and adduction. Now, ab and adduction occur in a frontal plane around an anterior-posterior axis. Abduction is defined as movement of that bony segment away from the midline of the body. A common way to remember abduction is to think to abduct something is to take it away from. So opposite to abduction, we have adduction, where the bony segment is moving towards the midline of the body. An easy way to remember this is that adduction would be as if you were adding something to the body versus taking something away. Here's an example of right shoulder abduction and adduction. Again, you can see our frontal plane in blue with our anterior-posterior axis in yellow. Here's another example, again showing left hip abduction and adduction, again occurring around that anterior-posterior axis. The one exception for motion in the frontal plane is spinal motion. Spinal motion we don't refer to as abduction and adduction, we refer to it as lateral flexion or side bending. So we can either have side bending left and right or lateral flexion left and right. Next up is rotation. Rotation occurs in the transverse plane around a superior-inferior axis. One slight difference with rotation is it depends whether it's occurring in the extremities or in the spine in how we name it. Here's rotation in the shoulder. It's referred to as medial rotation if the humerus is rotating inward towards the body, and lateral rotation if it's rotating away from the body. In the spine, we refer to rotation as occurring to the left or to the right. Now, a majority of motions in the body can fall into one of these three categories. However, there are some specific special motions that we need to discuss. Remember to keep in mind when we reference where these motions occur that we talk about these motions from the anatomical position. First up is ulnar deviation and radial deviation. Keep in mind the position of the bones within the forearm. As our hand moves towards the ulna, we refer to that as ulnar deviation. As it moves towards the radial side of the forearm, we refer to that as radial deviation. So let's take a look at that in our anatomical position for reference. As you can see, ulnar deviation, radial deviation occur in the frontal plane around an anterior-posterior axis. Now we'll discuss rotation in the forearm, which is referred to as supination and pronation. Our neutral position would be a thumb-up position at the forearm. Rotating the forearm so that your palm is facing upward is considered supination of the forearm. Great way to remember this is the position you put your hand in to hold a bowl of soup. Rotation so your palm moves downward is considered pronation of the forearm. Referencing our anatomical position, keep in mind this is actually rotation, so it would occur in the transverse plane. Another area we have very unique movements is at the scapula. The first one we'll discuss is scapular elevation and depression. Scapular elevation is a superior gliding of the scapula along the rib cage. Scapular depression would then be the opposite motion. It's an inferior gliding of the scapula along the rib cage. Our next pair of movements are scapular retraction and scapular protraction. Scapular retraction is described as a squeezing of the shoulder blades posteriorly and bringing them closer to the midline. The opposite motion then is referred to as scapular protraction, which is a rounding forward of the scapula away from the midline. Lastly, we have upward and downward rotation at the scapula. The key to determining which direction the rotation is occurring is by which direction the glenoid fossa moves. In this case, the fossa has rotated upward, so we have upward scapular rotation. As the glenoid fossa rotates inferiorly, we have downward rotation of the scapula. Rounding out the cases in our upper extremity is opposition, which occurs at the hand. Opposition is a combination movement that allows the thumb to rotate. This gives us the ability to align the pad of our thumb with the pad of the other digits in the hand. Next up is plantar flexion and dorsiflexion of the ankle, which occurs in the sagittal plane around a medial lateral axis. Moving the foot upward towards the dorsum or back of the foot is considered dorsiflexion. Moving your foot downward or in the direction of the plantar surface of the foot is considered plantar flexion. We also have inversion and eversion occurring in the foot. Inversion is movement of the foot towards the midline of the body. And eversion represents movement of the foot away from the midline of the body. Again, these motions occur within the frontal plane around an anterior-posterior axis. And then finally at the ankle and foot, we'd like to discuss supination and pronation. These represent combination movements that occur across multiple axes and planes. Pronation is a combination of dorsiflexion at the ankle, abduction of the forefoot, and eversion of the rear foot. So supination, that would be a combination of plantar flexion at the ankle, adduction of the forefoot, and inversion of the rear foot. Both supination and pronation are extremely important to how our ankle-foot complex functions. So to review, we've learned a lot of osteokinematic terminology. Our primary movements include flexion and extension, abduction and adduction, referred to as lateral flexion in the spine, and rotation. Some of the special motions we described are ulnar and radial deviation at the wrist, dorsiflexion, plantar flexion at the ankle, supination and pronation both at the ankle, foot, and forearm, our scapular motions, and opposition of the thumb.